On Cannabis Helps Dementia podcast, we learn from leading professionals and others on the front lines of senior care. Dr. Genester Wilson-King, MD, is a board-certified obstetrician and gynecologist with over 25 years of clinical experience.
I was just going to say, in regard to depression and anxiety, that is one of the hallmarks of the perimenopause and menopause transition as well. And I find that the patients, my female patients that have higher levels of anxiety do really well with cannabis. They do well with hormones, but they still need a little extra. And using cannabis is really effective, particularly the CBD, is an effective anxiolytic and mood stabilizer. And it actually doesn't work as an agonist at the CB1 receptor like THC, but it's an agonist at the serotonin receptor. So it will facilitate your body's increase in serotonin levels, which that's what antidepressants do by interrupting some of the physiologic processes. But see, cannabis does it in a very natural way, so you don't disrupt any physiologic process, and therefore you get your serotonin levels increased naturally, or physiologically is really a better word to use for that. And there aren't the side effects that you experience with the pharmaceuticals. It also inhibits FA, which is an enzyme in our body, part of our endocannabinoid system. And FA breaks down anandamide. Anandamide is responsible for that wonderful, blissful feeling. So you can have that hanging around in your body longer than you would without it. So CBD helps that. CBD also has activity in the emotional processing and memory and cognitive processes of the brain. And it's very helpful. And I don't want to leave THC out because I'm not a fan of separating out the plant like that. THC has been demonized too much, and THC is very medicinally beneficial, and it acts just like anandamide, which is what your body makes. And it's has well-known effects in the brain, like stopping those intrusive memories and that constant fight or flight state stress that we find, and that's because THC acts in the amygdala. THC also can increase serotonin via the prefrontal cortex, and it improves mood and memory while decreasing fight or flight, and does that via the hippocampus. So there's a lot that cannabis can do to help the areas of our brain, help depression and anxiety. And that's what I see it helping a lot in my senior patients. I've seen a lot happen with the addition of cannabis as a tool as part of my tool chest of things that I do to help patients.
Find the full episode on iTunes, Spotify, Anchor FM, or any of your favorite podcast platforms. And look for Cannabis Helps Dementia on YouTube.
Why don't you get wise, get up and get out, get rid of that frown that's been dragging you down, and get up in the air. Just pretend that you can fly. You'll never know if you can till you try.